Hospice nurse Pepper Cappuccio is talking with us today about his book, Warm Water, The Last Act of Compassion, his work with seriously ill patients, and the meaning he creates for those patients in their last moments. You're connected with the heart of hospice. I'm Helen Bauer, here with Jerry Fenter.
Whether you're a family caregiver or an end-of-life professional, we're here to enhance your hospice experience by connecting you with information you can use about end-of-life care.
This episode of the Heart of Hospice podcast is brought to you by Hospice of Southern Maine. As the leading nonprofit hospice provider in Maine, Hospice of Southern Maine is committed to high-quality patient care and providing professional and community education as well as grief support to the counties they serve. Hospice of Southern Maine provides compassionate care through end of life for patients with life-limiting illness and support for their families in the comfort of wherever they call home. Connect with Hospice of Southern Maine on Facebook, Instagram, or hospiceofsouthernmaine.org. Pepper Carl Cappuccio is one of my people.
He is. He's a hospice nurse. And, of course, that makes him one of your people, right?
It does. It does. He is definitely one of our tribe.
Oh, I would say so. And what such great insight that he has. And he's written about it. He's written a book called Warm Water, The Last Act of Compassion. And he talks about why he uses warm water for postmortem care.
Right.
Okay, so let's just think about this for a minute. The person has died. They no longer feel warmth or cold or pain, and yet he still makes it intentional to use warm water to bathe the body.
Right, and he intentionally asks for warm water or tells the family he's going to use warm water.
Right.
It's a wonderful ritual. It's very respectful, very respectful. So Pepper has been a hospice nurse for more than 10 years. He works in an on-call capacity most of the time, although he says he's cross-trained. He was a case manager for a while. He's had the honor of assisting hundreds of patients during the dying process, as well as performing the tasks that are associated with a patient's death, like death pronouncement and postmortem care.
So we are very honored to have Pepper today, and we hope that you enjoy this. And I will tell you that by the end of the interview, you might need a Kleenex or two because we did. And so we hope that you find this to be very encouraging and very inspiring. So here's our interview with Pepper Cappuccio. Pepper, we are so glad to have you on the Heart of Hospice podcast. Welcome to our little corner of the world.
Thank you for having me.
So tell us how you got started in end-of-life care. This is always interesting to us because we are a couple of people who kind of fell into this line of work. It wasn't something that we said, oh, one of these days I want to do that. Instead, it was, here we are, and we found our niche when we did it. So tell us how you got started. Was it intentional, or did you just kind of stumble into it?
I stumbled into it. I was working on a med-surg floor for several years and was very, very discontented with the way things were done with institutional healthcare and nursing homes or hospitals. So an unfortunate event happened. My mother became ill with lung cancer. And towards the end of the process, the chemotherapy and radiation were not working. And we decided to put her onto hospice. We went through the whole liaison meeting and got her introduced to it, had her come home, and then the care began for her end of life. And as I observed what they were doing, I said, this is what nursing is. This is what I want to do. So it really was just an accident that it happened that way. And it was a very good thing to happen in my life, particularly at that time. And here we are today.
So you've had a personal experience with hospice. Your mother was on hospice. How has that experience influenced the way that you care for seriously ill patients?
I think that either subliminally, subconsciously, or even directly, every time I'm caring for a patient, I think of my mother or even another loved one that I took care of at end of life. So it really helps you to focus, to have some empathy as to what the patient is going through and, of course, what the caregivers are going through. Because a lot of times the caregivers become the focal point because the patients become so close to the end where they're not awake, maybe they're in a coma, or they're sedated with the palliative measures, with the medications, that you're really taking care of that caregiver more than the patient sometimes. And they need also all the support that we give them. It's very, very critical that we support them.
So, I know we're not supposed to identify, and I guess maybe the word would be transfer our personal feelings onto a patient and a family, a caregiving situation where we're providing care. But do you think there's a little bit of an advantage to creating a personal connection? This is, similar to my mom. I walked in this caregiver's shoes, or this woman is caring for her mother who was about my mother's age when she passed away. Do you think that connection is a good thing? Do you think it's beneficial to you?
I think it happens all by itself. I know it leads into why I wrote the book, is that all of these similarities, it's like we're all the same. We're all going through the same thing. And you can look at different things, like you say that, there's a son with his mother, like I did, or I see certain little pictures or perfumes or books or records or music, and it takes you right back to your own experience. And it makes it very relevant at the time that you're caring for that patient, and helps you again to focus on what you're doing. All by itself. There's no effort even needed or necessary. It happens.
I think that's a good thing, to be able to identify with the personhood, for lack of a better word. Yeah. Jerry, correct me if I'm not using that right. That's sort of a spiritual thing. But to connect with the personhood, the humanity of somebody we call a patient, which is not an identity. It's just a role. It's a word and a label that we apply. But these are people. And I love it that your experience, hopefully it was a positive experience with hospice care for your mom, but to help you identify the personhood and honor the humanity of the patient that you're taking care of.
That's a great point. That's a great point. It was a great experience with my company, if I can say their name, Samaritan Hospice. Then I had moved recently to Florida for a few years, and that same level of commitment and care was just not there. So I wound up moving back from sunny Florida to here because of that dedication that they have within the organization that I work. And that really is very important to making your job less stressful, more rewarding, a little bit more easy to do and to be efficient as, when you have all the pieces, all the mechanisms that work together and mesh together to make it possible to do what we have to do.
Absolutely.
So were you the caregiver for your mom when she was on hospice?
I was living at home at the time, so I was the primary caregiver as dictated by what they consider from the hospice. But I have 4 siblings that are all healthcare, 3 nurses and 1 physical therapist. So we were all taking turns in doing things. Sure. I said, hello, I need a little help here, which is no problem. There's no problem. But I was with Mom at the end. You had touched on before about when you identify, when you're doing hospice, with a patient in their own setting, you have all that luxury, all that time to make that connection. Sometimes in the hospital you have a set of tasks that you do, whether it be hanging an antibiotic or giving them the blood pressure med, do a little assessment, you're on your way. Here you're with the patient all the way to the end. And in my case, as an on-call nurse, it is at the end most of the time when I see them, either right after they pass or just before. So you have, again, all that open time and freedom to do what you have to do to make the process go smoothly.
Right. So as the caregiver for your mom, Did you find that experience to be one that was helpful in your work? You know, being able to remember what it was like to be a caregiver, and then also supporting the caregivers for the patients that you have. Do you think that the experience of being a caregiver was helpful for you?
I was already a nurse when my mother got ill and went on hospice. So one of the first things that her primary nurse told me was, "You are not a nurse. You are
Right.
her son."
Good
So I had to
advice.
transition and make that change myself into being the son, and I became very much more relaxed. So that's one of the things that I try to tell people when I take care of their family member as well, because oftentimes there is somebody in that room, in that family, that is in healthcare. And the first knee-jerk reaction from us as a healthcare professional is to do the clinical. And you tell them, no, don't do that. So that's the grace of it all, is that you're able to just take a step back, and now you just act like the caregiver. So I can relate to someone who's doing that because primarily I was not forced into, but encouraged to be the caregiver. So that was a great learning experience that I've been able to carry through my own practice. It helped me to be able to guide the family members, to let them know that we're going to take care of everything that has to do with the medical part of it, the technical part of it. You're here, you're at home. You need to be able to have that time to stay with your loved one, begin the grieving process, all those things that go along with hospice.
So when the nurse told you that, this is not your space at the moment to be the nurse for your mom. You need to let that go and be the son. How did that make you feel? Did it startle you?
In the beginning, I felt like a little put back, like, what do you mean I can't? I'm a nurse. Who better to take care of my mother than myself? I know what to do. I know what kind of med to give, how to administer the meds. So in the beginning, I was a little put off by it, until I started to realize that they were good enough, the company, right? They were efficient enough that I didn't have to do everything. Of course, you do as a caregiver when the hospice organization or the employees are not there. You as the caregiver do sort of become a healthcare worker. You start giving the meds, or you call up the primary on-call nurse on the phone, and they direct you what to do because they're not there. You're the frontline person then. So I was all happy to do that. As soon as something was up, I'd call and say, "Hi, I'm Carl, and I'm the nurse, and I want to take care of Mom. You tell me what I need to do."
I used to tell family members that were, especially nurses, I said, this is the cream that you get to do, because this is not your job. This is not your role. And if you can set that aside, that's just another task that we will do for you, and you won't have to do. So you get the cream off the top. You get to sit there. You get to be with her. You get to talk with her. That's your role. And that's what we need you to do, because that's not our job. We are not the family members. So I think there's a gift there. But as a hospice nurse, to be able to tell a family member, this isn't what you're supposed to be doing, I think sometimes you have to step out with a little bit of boldness and be willing to tick people off a little bit, to tell them.
You do, because everybody seems to, in the age of technology, everybody seems to think, well, I'll just Google it and I can do it.
Oh, my gosh.
No, you really can't. I understand that you're knowledgeable, and it's great that you're trying to learn what you need to do, but you almost want to say you don't. You're not a healthcare professional, but thank you for your help. Or I'll be very nice and say, "Oh, that's so great that you're doing research. Thank you so much for doing that. I'm sure it will help." When you're here, when you're by yourself, and I guess it does, and it gives them comfort, I guess, because it's control. People are losing control because their loved one is passing away right before their eyes, and they want to be able to do as much as they can. And they really, in the beginning of the process, they fear. As soon as you walk out the door, if they're not a healthcare professional, they're like, "Oh, what do I do?" Because there's a lot of people that have that kind of feeling, like, "We don't know what to do. You need to come right back. You need to help us."
Right.
So there's a lot of teaching, as you know, that goes on to help them be able to do what they need to do.
There's a thing, I shouldn't say it because it's not very nice, but it's like I'm not a brain surgeon, but I've watched Grey's Anatomy a lot.
Yeah.
That sort of thing.
Yes.
Yes. I'm all for you looking on the internet if that's what makes you feel a little bit better. And I would educate my families on that. But I would tell them stick to mainstream sites and remember that not everything you read on the internet is applicable to your situation. And that's hard. People are looking for hope and help and a sense of control. I think you're right. Absolutely.
Yeah. So, Carl, how long have you been in end-of-life care?
Since my mother became ill in 2009.
Okay.
Oh,
And
so
then
over
in
10 years.
2010, I got hired. Yeah. They didn't allow, I applied immediately and they said, no, we need you to be able to mourn the loss. And then we can, bring you on. They vetted me a few times. I had to have a couple of different interviews before they were satisfied that it would be a right fit. Because not every single nurse could do hospice care.
True.
The fact that you apply for the job says something in the beginning, but then they want to really make sure.
So were you kind of aggravated that they said that at the beginning? Were you startled?
No, I actually appreciated it immediately and said, these people are for real. Because it made perfect sense, of course.
Yeah.
I'm emotional at that point. Why? Maybe I should wait. Yeah, and especially now, I look back and say, what a perfect thing to do.
Mm-hmm. Definitely. So, have you always been the on-call nurse, or have you worked in other positions?
I've always primarily done this 99% of the time, but I've taken the time at different intervals to do each position so I could better understand what everybody else goes through.
Yeah, good.
Making all those pieces fit. So I've done inpatient care, and I've done a primary nurse census. You get your own census. That's much more difficult, I think, than what I do, because you're case managing several patients. The turnover is outrageous. Patients are dying all the time, of course, and it's a much more emotionally taxing position because they have a rapport, I think, a much deeper rapport with the patient and the families. Whereas if I go to pronounce a patient, that may be someone I've never met. So while I have sympathy and some empathy for them, I don't really have a connection to them. But in the book, you can see that there are patients that I did get to know, and it did create an emotional bond, and it was difficult. Human. You always try to not cross the barrier and make it about you and get upset, but sometimes you just can't. It just crosses over the line and envelops you, and you're kind of stuck in it for that minute. But families understand every time.
I want to come back to that because I have some notes that I flagged in the book related to exactly that. But let's talk about the book. Warm Water, The Last Act of Compassion. So you work as an on-call nurse, and one of the primary functions of the on-call nurse turns out not just to respond when there's a crisis or a symptom problem, but to a death. Tell us a little bit about the work that you do and the responsibilities that you have.
So my responsibility is to go there, of course, go see the patient. If they're right before death, make sure it's as comfortable as it can be. And if the family suspects that they have passed away, then I go and I do this assessment on the patient to be sure that they did indeed pass away. And it's interesting. I think I touched on it a couple times in the book, where the family knows in their heart of heart, they know the patient has gone, they've passed away, and they still want you, the nurse, to do the job of telling them that they died. So it's almost like a little theater. So I go and I could tell sometimes immediately, like I'm sure you have yourself done in the past. But I take the stethoscope and I listen to the heart, listen to the lungs, check the pupils, and do a pretty in-depth thing. And then I, of course, calmly turn around and tell the family they had passed away. So that immediately opens up the door to them starting to grieve. They start that grieving process. And then I move on to do the next set of tasks, which are to prepare the body for them to leave, to go to the funeral home. So I'll ask the family, touch on, who we're going to call. And then I very gently, again, in a nice way, ask them to leave the room. And then I go through the preparation of the body for the transport to the funeral home. So something that I've always done and learned from my preceptor in hospice is that just because the patient has died and can't feel anything, you don't use cold water. You do warm water, and you give them a bath just like they were alive. You use all the gentle strokes, all the gentle movements, do the hair, wash the whole body, just as if they were alive. Prepare them, change the clothing, change the sheets if you need to, and then you have the family come back in to view the body. And it's a beautiful experience. I relish and enjoy each time. I've had people tell me it's a little bit weird or morbid, but I enjoy that time with that person because I think it's such a respectful thing to do, and it gives me that human purpose rather than just that medicinal purpose in taking care of that patient.
To me, it's a ritual that is about transitions. Mm-hmm. Because so much of what we do in hospice are jumps and falling off the cliff. They come to us after being told there's nothing else we can do. Boom, that door is shut behind them, and they've got to navigate into a different silo of what we're supposed to be doing. And then when the death occurs, then you treat that body as if it's a thing. We're going to put it in a bag, and we're going to take it out of the house. It's going to be rolled out by people you've never met, things like that. And I think this act, this ritual of bathing in warm water really honors their humanity. Goes back to the personhood. It's not a thing. It's not just a body. This is a person. This is a father, a spouse, a sibling, someone who's a dear friend, someone who's loved. And it's a way of honoring that identity, especially if you're using warm water. You're acknowledging the body needs to be cleansed. We understand that the spirit is gone from the body, but the physical body is still important. And I think that's actually very important to the family. And maybe it's an important ritual for you as well, as a hospice nurse, to be providing that care and honoring your patients as you go.
The ritual is very important to me as a hospice nurse.
Yeah.
And I try to make them aware that I'm using warm water. I might ask them for a basin. I want to get some warm water. Because sometimes they'll start bringing you rags. They're cold. I'm like, oh, no, I need warm water. Right. And a couple of other things, like I try to personalize it even when I get there. So if the patient's name is Robert, and the patient's passed away, well, some nurses might say, where's the patient? I personalize it. I'll say, where's Robert? Mm-hmm. And I'll go back. I'll ask them their cultural preferences if they have one. Sometimes it's, I guess, important if you see somebody, if they're Asian or Indian, you can sense that there's going to be something a little different. So you ask them, is there anything special you want? Some cultures don't want you as a man to touch the woman. I've had people say that we'll do the bath. Again, just because they're passed away, you still respect them as if they're there. And you ask them, can I do this? Can I do that? And they're so great. They're just so grateful that you do all that. And it really makes them feel a lot better that you've done that whole process.
We're excited to share a great educational opportunity with you. The California Hospice and Palliative Care Association is holding its annual conference coming up in June of 2022. It's going to be on the beautiful campus of Chapman University in Orange, California. The conference starts with an LNEC communication curriculum on Monday and Tuesday, June 6th and 7th, followed by the annual conference and exposition Wednesday through Friday, June 8th through the 10th. The theme for this year's conference is Back to the Basics at the Bedside. You'll hear information on the basic principles of the pillars of quality hospice care taught by experts in the end-of-life industry. This is a great opportunity to get those continuing education units and to reset your focus on what's really important in patient care. Early registration is open until April 1st, so visit the CHAPCA website at calhospice.org to register and tell them you heard about it on the Heart of Hospice podcast.
Our sponsor today is Hospice of Southern Maine. Hospice of Southern Maine makes it their mission to provide compassion, care, and comfort for people with a life-limiting illness and support for their families in the comfort of the patient's home, or at Gosnell Memorial Hospice House, a home-like setting featuring 18 private rooms and 24/7 care. Hospice of Southern Maine is proud to present the Thresholds Conference coming up in May of 2022. The conference provides the opportunity for families, friends, healthcare professionals, and caregivers worldwide to participate in meaningful conversations with recognized leaders in end-of-life care. This year's theme is Grief is Individual and Universal. The 2022 Thresholds Conference features #1 New York Times bestselling author of Eat, Pray, Love, Elizabeth Gilbert, along with Grammy nominee singer-songwriter Michelle Zauner, author of Crying in H Mart. This year's conference focuses on grief, understanding that while grief is universal, it's highly individualized and no two people grieve alike. For only $35, you won't want to miss this Thresholds Conference on Tuesday, May the 10th from 1 o'clock to 3:30 Eastern Time. Register at hospiceofsouthernmaine.org and click on Events. You can also follow Hospice of Southern Maine on Facebook and Instagram. Now back to today's episode.
So all of these patients that you've cared for and provided this ritual, it obviously became a theme
Right.
through the care that you gave. You talk about it a lot it's a thread that goes through the whole book. So what prompted you to put all those stories about your experiences into the book?
A lot of the times when I'm doing the bath, frequently, there are people that want to be there, whether it be the wife or a daughter. And I'm a very personal person. So as I'm doing the cleaning and bathing and they want to help, you start to chat, you start to talk. To me, it was so fascinating in the beginning because I'm thinking, wow, I opened up a can and they're just going on and on and on and on. And that's where I started recognizing all of these similarities between myself, my own mother, and everybody. They're almost identical. The names of the people are different, or the disease might be different, but the same circumstances there. You've all lost someone you love, and you start reliving the life's experiences, which is, as we've talked about before, is one of the most effective ways to start grieving, is to start reliving your experiences with that loved one. And people love it. They just love to do that.
So now that we're talking about the book, I want to jump back to the question that I had. When we were talking about, you talked about how difficult it is for a case manager, a nurse who's case managing a caseload, and the compassion fatigue that you accumulate because you're so embedded and involved in your patients' lives, as a care provider. So I had a thought. I was telling Jerry, I wonder, so I guess it would be quality versus quantity. So the experiences that you have with patients, those are very intense experiences. You may not have the number of contacts the way a case manager would have, but you have intense experiences and events. You're there for symptom crisis with a patient and a family, or you're there at the death of a patient. And, what do you think about compassion fatigue for a nurse who works like that? Do you think it's less or it's about the same as somebody who has all these exposures to a patient week after week?
I have found that the nurses who have patients week after week have much more compassion fatigue than people in my department. And there are actually times that they're allowed to take a few days off for that to kind of decompress, especially if they go through a particularly trying case where it might be a young person, 17-year-old, or something that really touched them. And so we have this open policy at work that we're allowed to tell our managers, listen, this was bad. I need a day off. And they encourage you to do that, which is, I think it's a great idea in organization to do that.
Oh, absolutely.
I've never had to do that. I've had compassion fatigue with patients, but I do get a lot more time in between cases than they do. So I have the ways that I can decompress on my own. And one of them, if you notice in the book, is music.
Yes.
Before, during, and after.
Yes.
Yeah.
Yes, I noticed that.
And that's what I do. As soon as I get in the car, I kind of set myself into a mood. So I put on the radio and I'll listen to music before I get there. And then I have to, of course, you put on the face as soon as you get out of the car. You say, okay, I'm here. You know, you have to be a little, especially if you're rocking away in the car to a fast song or something, right? So then you get into the house. And sometimes I'll put music on after. And sometimes the music is just accidentally apropos or it relates to what just happened. So again, that's so surreal to me that these cases just all kept pointing to myself and my own life. And then as I was writing the book, I was now looking for it and finding it. Like, wow, look at this. I mean, if you notice at the end of the book, the last two chapters, not to give it away, but you couldn't make that up. You just could not make that up.
Now that's intriguing that you tossed that out there. That's definitely a teaser
I know.
for people to get the book. So what really prompted you to write the book? Have you written any other books?
I've not written any other books. I've always wanted to be a writer. When I talk to colleagues and talk about stories like that, they said, why don't you write a book about this? Why doesn't somebody write a book about end of life and those experiences? So I decided to take a stab at it. But there was never seemed to be any time. And personally, I had a diagnosis of cancer, which I'm perfectly fine now. But I had all this time off one summer. I said, you know what, let me start writing the book. And it just kind of just took off on its own.
It's amazing. They say when you think about, as an author, if you want to write a book, what do you write about? You write what you know.
Of course.
Right.
Easiest thing.
Yeah. And these personal stories, because while these stories were accumulated through your career and your work responsibilities, they are your personal stories.
Right.
One of the things that I noticed in the book is a lot of times you were managing the postmortem care, with the bath being part of that, the postmortem care. A lot of times you did that on your own, but there were times that the family wanted to help you. And I was kind of curious, what meaning do you find when a family helps to bathe a patient? When you become part of a ritual that incorporates the people that this person loved?
That whole thing of bathing your loved one, it's sort of, I think, my own personal opinion, it goes back to motherhood, which I'm not a mother, don't have children, but that bathing your baby, right? Isn't there some kind of feeling in that? So there are people, particularly in my culture, in Italian and in Irish, where they almost insist, we're bathing, we're going to be with you, because it allows them to make that final, almost like a goodbye, like a closure kind of thing. And again, that's when they start talking. They start talking about things. They might have a scar, or they have a necklace on and say, oh, I gave him this necklace, or that kind of thing. All those kind of stories start to come out. So that's when I try to elicit the stories with these people. So interesting, fascinating, people's lives.
There's an intimacy to performing an act like that.
Yep.
Yeah, and the fact that you get to share in it. So for our listeners, if you ever wonder why we do this kind of work, there you have it right there.
That's it right there. If I wasn't able to do the ritual and talk to the families, what would I be doing? Saying, okay, he's dead. Let's wipe him down and send him out.
You're just meeting the regulation, doing the assessment.
You're doing what you do in the hospital.
Right, checking the boxes.
Like the hospital. Yeah. You don't have that time to do that. Hopefully that'll change. I think it might be changing, but I don't know now with the pandemic how things are. I think it's worse, probably.
Probably so.
That coldness.
Mm-hmm. Pepper, how has working in end-of-life care changed you as a person?
It's changed a little bit of perspective, but it's also reinforced what I already know about how important end-of-life is. I think that's why it's such a perfect fit. I just fell right into it. It's just like a natural. That same preceptor that had helped me in the beginning with my mother was one of the ones that trained me in the beginning. She said, you are just unnatural. And I didn't know 100% what she meant until I got a few years into it. Thought, yep. Because it's just, I feel like I don't work. When I work, it's like I'm not. It's like I'm doing something I love. And it's like, it's so enjoyable. I know people don't think that that's the right word to use, but my philosophy is when a patient comes on to hospice, we already know the outcome. Our job is to navigate that experience for the family and the patient. And if we do a good job, then we should be very satisfied and rewarded by doing that.
Right.
everybody makes mistakes. Sometimes you fall a little bit. Sometimes you do something that's a little bit off and you start to realize, oh, I better do this a little different, especially at the end, because when you're taking care of a loved one's recently deceased family member, you have to really be careful because it's very, very important to them that you do it just right.
Right. Well, we say often that, in hospice, we only get one chance to do it right.
That's right. One time.
Right. One time, and that's it. Well,
I'm laughing at myself because that brought tears to my eyes to hear you say that. Oh, my goodness.
Yeah. Pepper, you have evidently struck a chord because I think it's...
it was the part about being the perfect fit.
That's true. Yeah. So I want to come back to that for just a minute because you said it seems odd for you to say that you enjoy doing this kind of work. And I'm sure there's a lot of people who say, yeah, why would you enjoy working in end-of-life care?
Right.
And yet
it's weird or morbid.
Right. But yet at the same time, I think most families and patients would prefer that someone who enjoys their work be the ones who care for their loved ones.
That's a good point. Would you want somebody who didn't enjoy the work they did to be the person who cares for your loved one in their last days, their last weeks?
I totally agree. That's a great point. Because there have been, with the nursing shortage that we're having, there have been some nurses that they brought on that don't, I can recognize that they're good nurses, but they don't have that hospice mentality.
Right.
And I think it shows in their work. The family members are not 100% happy. Like, why did it take them so long to get here? Why did they leave so quick? Why? Why? That's what it is. If you make the family feel like you've got their back and that you're taking care of them perfectly as much as you can, then they're satisfied.
Right. And I think as team members, we prefer to work with people who enjoy what they're doing.
Oh, absolutely.
So, yeah, I think it's good for us to say that we enjoy the work that we do. I can say that. I love my job. I love what I get to do.
Yes.
And, 12 years ago when I came into this, I left what I thought was a very wonderful career in ministry. And yet hospice was definitely my calling. It sounds like it's definitely that way for you. You've had your own preceptor who told you you're a natural. That's awesome.
Your mom. That's pretty amazing that your mom was sort of a preceptor for you to tell you this is your gift. This is where your skills are. Yeah. Oh, gosh. It's not a good interview unless somebody cries, so I guess it was my turn. Oh,
you're making me cry now.
I'm telling you. That's terrible.
No crying. You're not allowed to cry.
Oh, that's awful.
Oh, that's great. Well, as we come to the end of our interview, we want to ask you one more question because we always want to ask our guests about their self-care because we feel like it's so important. That's how we maintain our abilities to do this kind of work is providing ourselves with good self-care. So over the past few years during the pandemic, it's like self-care has just been completely thrown aside in many ways because the challenges have been so great. So how has your self-care changed over the last few years, for better or worse?
I've had to adjust with the music, so I'll just put on something on the radio or Alexa, and then of course I get my pretend microphone. Then that's my other alter ego. I want to be a singer, so I just sing away real loud, la, 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 like that kind of thing. I was talking to a friend about because we talked about the same thing about what do you do to decompress, and what I do is that's my decompressing, if that makes sense. In other words, when I don't work, I'm having this problem that I'm kind of lost. So I don't know if that's a good thing or a bad thing. So if I'm not working, I'm not having any satisfaction. It's like I want to do it all the time.
Mm-hmm.
And so as I get older, I almost fear retirement because what am I going to do? I'm never not going to be able to not do hospice. It's never going to happen. I have to do something to keep myself involved somewhere. So I wrestle with that. Is that a danger sign that I'm so addicted to what I do? That is my decompression. If I have a rough day with something at a meeting or with a coworker or something I'd like to see on the news, when I go out and take care of patients and do what I do, the world is okay. Sort of like in reverse.
Mm-hmm.
I've never thought about it that way, but it's meaning, it's purpose.
Yeah, but then of course mentally and intellectually, I know that you have to do something to, even if you don't think it's a problem, you have to do something. Dance, sing, go out, movies, read, write, things like that.
Perfect.
Yeah. That's great. Pepper, thank you for taking the time out of your day to talk with us and to share with our listeners. It's been so good to hear from another hospice professional, especially one who enjoys their job like you do.
Absolutely.
That's awesome.
Thank you so much for having me. I appreciate it.
Certainly. So the book that Pepper has written is called Warm Water, The Last Act of Compassion. And we would encourage you to find that book. Pepper, can they find it on Amazon?
It's on Amazon, but there was an issue with the previous publisher. So the best way to get the book is to go to my website, which is the author's name, peppercappuccio.com. And you'll see all kinds of blogs on there and entries and comments and a way to link right to Amazon to get the book. That's the easiest and I think best way to do it.
We'll make sure there's links to everything in the show notes so our listeners can go straight to it.
Perfect. Thank you so much.
You're awesome. Wonderful stories. We know the listeners are going to love it. Thank you for sharing all of it with us.
Thank you.
Okay, so now you know who really needed the Kleenex. And you can still hear it in my voice.
It definitely was a little bit shocking and surprising to you, wasn't it?
Yeah. The waterworks just kind of hit, and then it activated my sinuses all at once. And so it was just a big mess of tears. It was one of those ugly cries, right? Oh, my gosh. But, for a hospice nurse, and I hope there are hospice nurses listening to this, our friends, there are a lot of you out there. We love you guys. We love the work you're doing. We hope this episode is connected with you. You are the people doing this work. You are the people that are there making those pronouncements. You are doing those death events. You are the ones providing symbolically the warm water for these patients' transitions away from their families.
I really think that for those of us who work in hospice, that this book would be very, it would provide a connection for us because we could read this book and see, oh, this is something I've experienced. I know what this is like.
Yeah,
especially,
these are my patients.
Right, especially for a nurse.
Yes.
Who has made those death pronouncements. Maybe not for a chaplain or a social worker, but I think even as a chaplain and a social worker, we connect with what Pepper is writing about.
Absolutely.
And it really does help. So one of the things that we talked about while we still had Pepper on the line, that we didn't record it, was how many hospice providers would connect with this book. But he said it really could be something that anyone could connect with. Because
it's about stories.
It is.
That's truly what it's about. Okay, so it happens to be in the setting of hospice care with somebody who's critically ill, but it's about stories. It talks about these different patients. I mean, these are the people that I have seen. These are the people that you have worked with, all the patients we've seen through the years. So we would encourage you, if you are a hospice provider, to find the book. You can go to peppercappuccio.com, his website, and you can order the book there. It'll take you to Amazon and let you order the book. But also, if you're a manager, an administrator, a director of nurses, an owner of a hospice agency, this is a wonderful resource for self-care for your team members. For you to purchase several of them, purchase them for your team, let them read it, give it as a gift for Nurses Week or National Hospice and Palliative Care Month, whatever you want to use it for, just to let them know we validate, we see the work you're doing. And I think that's one of the things that's so meaningful about the stories that Carl shares. You see the work that he's doing. We see you. This is what we do on a daily basis. I don't think I'm even doing it justice in the way I'm describing it.
Right. Because here's what I know. I watched you as you were reading the book, and I could tell that it was connecting with you.
Because of all the sticky notes that I wrote and put on the pages.
Right.
But yeah, there was something validating in every single story, something that I could connect with every chapter, because each chapter contains a story of an experience with a patient and that patient's caregiving unit, the family.
Right.
Yeah, I've been at those bedsides.
Absolutely. Absolutely. So if you're a hospice provider, nurse, social worker, chaplain, doesn't matter, CNA, you would find something in this book that would encourage you, inspire you, and something that you could connect with, because this is you. This is who you are. He's writing the stories that are your stories.
Right, the work that you do.
Right.
And I would say also, if you're a volunteer coordinator, this would be a wonderful gift for your volunteers.
Oh, absolutely.
And it would be a great handout book for onboarding for your volunteers and for your team.
Good idea. Very good. So to find the book, we would encourage you to go to Pepper's website, and it's just peppercappuccio.com. And if you're not sure how to spell Cappuccio, just use the link in the show notes, and it will take you right to his website.
Thanks for listening to The Heart of Hospice. I'm Helen Bauer here with Jerry Finter. Because we know your hospice journey is 24/7, you can always find us at theheartofhospice.com. Subscribe to the podcast wherever you're listening, and please take a minute to leave a rating or a review on Apple Podcasts.
If you'd like to connect with us, you can always send us an email at host@theheartofhospice.com. And you can also find us on social media. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.